Hi, I'm John Filardo, Senior Vice President here at the American Chiropractic Association. I'm joined by two good friends, Brian Sutter, Chris Davis from the Capitol Hill Consulting Group. We're here today to talk to you about our Medicare bill and HR 539 in the House, S106 in the Senate, and it's the Chiropractic Medicare Coverage Modernization Act. Most of our folks should be really familiar with this. This is probably about the fourth session we've had it in the House, and it keeps getting more support each session. We're up to 107 co-sponsors today in the House, 12 in the Senate. Last session, as you know, we finished with 180 co-sponsors in the House and about the same number in the Senate. So let's start discussion about that. Let's just say what the bill does. Let's talk a little bit about that. Brian, why don't we start off with you? Let's talk a little bit about that.
Yeah, no, absolutely. Glad to be here, John, and to talk about this bill. And really, it's about modernizing the statute and giving seniors the options that they deserve that they have anywhere else in healthcare, but not in Medicare. And that's a real flaw. So what we want to do is make sure that chiropractors can practice up to the full extent of their license in a state in the Medicare program. That's what the bill does. It's pretty simple.
Right. Yeah, and one of the things too, I'm asked even by members of Congress is, why didn't you guys go through the regulatory route with this?
Yeah. And
Chris, you want to talk a little bit about that?
Mm-hmm. Yeah, I mean, it's hard. I think that's would be an easier option if that was available, but unfortunately, it does need a statutory change to make this happen. And we have explored other possibilities to see if we could do that instead. But unfortunately, we need that statutory change. We need Congress to take action to make it happen.
Yeah, and the only way to fix a statute is through legislation.
Through legislation.
And let me just give folks too a little bit more of a history lesson. Is that we did try to go through the regulatory route with two different secretaries of HHS. One Republican, Tommy Thompson. You remember him back in the Bush days, and more recently, Kathleen Sebelius, when she was there under the Obama administration. And she was I was in that meeting. The Thompson one was before I got here, but I was in the Sebelius meeting, and she got it. She this is crazy. Why is it this way? Why are chiropractors, and more importantly, beneficiaries handcuffed here? And she assigned us a liaison to CMS and all this kind of good stuff. But it just kept coming back that we can't do anything. Our hands are tied too, and that you have to fix this through legislation. So it was back in 2015, 10 years ago now, that the ACA House of Delegates voted to make this our number one legislative priority going forward. And I think too, what's important to note is that this adds no new benefits, right?
yeah, and that's just it. I mean, these are services provided already within the Medicare program and things that chiropractors can do already. It's just really breaking down the barriers, because to your point, when they created the ability for chiropractors, they said very specifically, these are the only things you can bill. Well, that doesn't make a whole heck of a lot of sense now. Clearly, medical delivery has changed over the years. The words on the page of the Medicare statute have not. And then that's the trouble with Medicare, is you got to keep going back and updating it. And so we're just refreshing. We're letting the Medicare statute catch up to how medicine is delivered today.
Right. And that statute goes back to 1972.
Correct.
Back before you guys were. I was in 8th grade, so I don't remember it, but it happening and all. But at that age, no, I wasn't paying that much attention. Let's talk about something too, an issue that I hear a lot about. Folks ask, well, why is it opt-out? Why isn't the ability to privately contract with beneficiaries? Why isn't that in the bill?
Yeah, well, I think as we've talked about over the years, really this is about modernizing the statute to reflect where the current practice of chiropractors are today. So, and I think we've really leaned in on that. We've provided a lot of data to members, Congressional Budget Office, and others. So when we're talking about modernizing and improving the statute, we don't really want to say, hey, let us opt out as well. It's kind of stepping on our toes and really mixes our messages with members. We're really leaning in, and frankly, given the co-sponsors we've got both on the House and the Senate, it's extremely bipartisan. That message is working. We need to continue to go on. So let's not get distracted.
Yeah, I think that's such a great point, Brian. It is very bipartisan. Members from across the spectrum, left, right, center, every part of both sides of the party, really shows that strong support for it.
Well, let's put on our congressional staffer hat, and we all work on the Hill. We'll put that hat on, and if someone came into me and say, "Hey, I would love to have beneficiaries have greater access to chiropractic, and at the same time, I want to opt out." Well, my first question to that person would be, "Well, which is it?
Yeah.
Which is, do you want to be able to deliver greater access or have greater access to Medicare beneficiaries, or you want to be able to opt out?" I mean, you can't run those on parallel tracks. You have to, it's one or the other. And once we are successful with the modernization of that, yeah, we can go after opt-out. We should be able to opt out like any other provider, but physician level provider. But you can't do that as you're asking for your patients to have greater access to the services you provide. It's just a contradiction, really, and it just really muddies the water. It's just not a consistent message, and that's what you got to have on Capitol Hill. And this goes back to the beginning of the Republic. You have to have a consistent message, and you just can't have one that's like being able to opt out and having greater access at the same time. Now, with the one big beautiful bill out of the way in the rearview mirror, do you believe Congress can now turn its attention to healthcare issues in the fall?
Yeah, I mean, I think if you look at that big beautiful bill, as the Republicans call it, they had some significant changes to Medicaid, but really those were offsets or budget savings that they wanted to use to offset the cost of their tax bill. There wasn't really a lot of healthcare policy either. It was more financing. So a lot of stuff was left out on healthcare, frankly. You were able to get some of the payment updates for Medicare for physicians in there, which was a good thing, but it's only a 1-year piece of it. So there's a lot more left to do, whether it's Medicare physician payment, PBM reform, the enhanced tax credits for the exchange. So there's a lot of interest there. In fact, if you look back to last December, there's a bipartisan package that was put together that didn't get together. There's a lot of pent-up desire to move things. So yes, they will do that. Now, we'll be clear about it. There's a lot of partisan animosity right now. They're not talking to each other. But yes, at some point, as we go into the fall, nearing December, when there's traditionally a healthcare package put together, I do think the elements are there for something, but we're going to have to see how it plays out.
Yeah, no, I think that's exactly right. And there are a number of, must-pass policies that need to be extended around community health centers, around opioid prevention. So there and around funding the federal government as well. So there are big healthcare things that have to happen, which then whenever there's a must-pass bill, all these other policies start to get kind of added onto it and turned into that larger package as bipartisan priorities get put into it.
Yeah, and this is not news or really inside information at all, but I was with the chairman of the Ways and Means Committee earlier this week, and the question was raised to him, what do you look to do in the fall? And he said, well, we just got through with taxes. He said, we worked on trade, and I really want to get something done on healthcare. And he said his super focus, and so he's super focused on access. And those are that's music to our ears. And I was sitting next to his chief of staff, and I said, that's very encouraging. He said, it certainly is. You recall, Jason Smith was our lead Democrat, or lead Republican on the bill a couple of sessions ago before the Republicans took the majority in the House. So he's very familiar with this. He was the one that instructed Greg Steube to run this bill last session and this session as well. So he's very familiar with us, very familiar with the bill. I want to thank our folks in Missouri for really creating that relationship with the chairman. We've been in meetings in the Capitol with him earlier this year, as you recall, and you can't just ask for, we're not dealing with some backbencher here, right? We are working with the chairman of the committee, the main committee of jurisdiction on this, and his hand-picked person to run the bill. So I feel good about this coming in the fall. I felt good last fall too, but I think even now, coming out of the chair, he really wants to do this. And as you folks know, in working with Jason Smith, he doesn't slow down. He's going to move forward.
Yeah, well, look, he was a main architect of that big, beautiful bill. That was a priority of the president, and the president trusts him. And so I think from that standpoint, if he can pull together a bill that focuses on access, and we saw a hearing just the other day in his committee where they focused on access and specifically access to care in rural areas. That has been his primary focus. And so I think we just continue to rely on him, and he's been very good at working with the Congressional Budget Office and all of the other machinery that needs to happen to get this bill done. So yeah, we're in a very good spot.
Yeah, I think. Well, speaking of a good spot, the calendar is now August in Washington, even though it's July 24th. The House has left for their traditional August recess, and they left a day early. We all know why. I'm not going to get into that. That's another video interview in itself, right? So the House now is home. The Senate's going to stay, I believe, in next week, and then they'll break for the recess as well. So what unique opportunities do you see for us in August, and as far as advocacy and action that our folks can do?
Yeah, absolutely. I think August is a great time because, this is the time when members have an uninterrupted month or 6 weeks, as is the case this year, to really talk to their constituents. Because ultimately, members of Congress, senators are responsible and beholden to their constituents back home. So you have a lot of great opportunities, whether it's inviting the members or their staff to come visit your facility, going to the district office to talk to the staff, talk to the members in person, talking to the members and staff in the community when you're back home, and just talking about how important this bill is and how important it is to move this legislation later this year. Normally during session weeks, members are traveling back and forth between DC and they only get a couple days back home. But this is a time where they really get to dig in and hear from their constituents and hear about what's important to them.
Right.
Yeah, and I would say last year was a presidential election year. There's a lot of focus on the campaigns. That's not the case this year, right? That is some time off yet. So
That's a good point.
Hopefully they're not running from one thing to another. They've got a little bit more time, like Chris said, to sit down in their district office or at a facility, at a practice to say, what are you hearing? Let's talk about it. So that's a really great opportunity. So I would send out the invites, get their members there, and then develop the relationship with the district staff. So
right. And we talked about this and maybe an angle folks can take. And what I always tell folks, this, as we talked about before, this is an access issue. And that's what members like to hear. What they don't like to hear is about reimbursement. Now, we all know it's not good, but they need to hear what's in it for the beneficiaries, not what's in it for them themselves. I think if you go in there with that, I guess I'll use the term self-serving attitude, rather than that you're looking out for your beneficiaries, your patients, that access issue, that's what's going to win the day, right?
Yeah, absolutely. And it's also a matter of fairness, too. I know a lot of the chiropractors I've met with over the years, they talk about how great of a job they do in the community for those under the age of 65. And then simply because they become a Medicare beneficiary, all of these roadblocks are put in place and they're not able to do all of the services they were able to do otherwise. That doesn't make a lot of sense. Members of Congress really understand that. And so talking about how it's not fair and it's reducing access and we should just continue to be able to provide the care that they come to rely on from us, members understand that. And if you get to, you talk to members, hey, they're on their feet a lot. They understand the value of chiropractic care. And as we've gone around and had meetings with members of Congress, they're like, yeah, I love my chiropractor back home. And that's a great thing. And those are the stories you really want to tell. Hey, I'm providing care for you. Why should that stop when just because you're in Medicare? That doesn't make sense.
Right. And you mentioned this, Brian and Chris, both of you guys mentioned this a little earlier on, with bipartisanship at what seems like, I guess, an all-time low right now. How do we talk to offices about this straightforward and yes, bipartisan bill?
Yeah, no, I think that's exactly right. I think that, the very large framing of everything right now is very partisan. There's a lot of, there's a lot of very strong feelings out there. But there are a lot of bills and hearings and policies being discussed every day on the Hill that are bipartisan. And it's our job to make sure to highlight those, talk about how, as we were saying earlier, there are members on both sides of the aisle who support this across the political spectrum. This is not a partisan issue. As Brian was saying earlier, this is about access for patients, access for seniors, and how we can improve their lives.
Let's stay on this because again, this subject is very important with the recess and everything. How can a doctor or student or even a patient find when and where members of Congress will be holding meetings either in person or virtually? Let me just stop right there a little bit, but I think a lot of these meetings, more of these meetings, are happening virtually for a lot of reasons, security and so forth. But what's the best? How do they best find out when the website, things like that, right?
Well, that's just it. Go to their website and see what's putting out there. But every single website that you show up to says, "Hey, sign up for my newsletter."
Right.
Put your email in there. Oftentimes what they will do after that is say, hey, what's your zip code? What town are you in? What are you most interested in? Members of Congress have gotten very good, like the rest of society, of targeting their messages. And so, hey, I want to know when you're in my community. They will tell you. Many members of Congress have multiple district offices. There's probably one near you. Get to know that person. They all have community representatives. I know when I worked for Dave Camp, we had 14 counties. They had 5 staff. Each staff was represented to a different county. Find out who that representative for that county or your city is, and just say, hey, let me know when they're in town. I want to meet. Those are great ways to do that. It doesn't have to just wait for them to tell you. You can be proactive.
Yeah, that's exactly right. And I think the benefit then too of, signing up for that newsletter, getting to know the local staff, is you can get to know what's important to that member of Congress and then personalize your message to fit that,
Right.
and really make it a two-way street, to really make sure that you're also speaking to the member in terms that resonate with them.
And patients make great advocates too, right?
Absolutely.
Exactly,
Yeah.
absolutely.
I remember we did an event for Richie Neal, who was then chairman of Ways and Means up in Massachusetts, and there was a patient there that a doctor brought, and he listened to the patient tell a great story. How, like you were saying, you're on private insurance, you turn 65, and all of a sudden that benefit's gone. It's a ghost benefit, right? So they were very interested in that. So, and also, I want to make sure folks know to go to our website, acatoday.org, and you'll see it running across the crawl on the homepage. But we have tremendous resources about how to set up a meeting and things like that. And just go into that resources tab and look all around. Boy, our communications team has done a great job putting all that information out there. If you've done this 100 times or if you haven't done it at all, we can walk folks through it. So please go to acatoday.org. You'll find that out. Someone, and I think you touched on this, Brian, if someone can't make a town hall virtually or in person, how do they go about setting up a meeting? Just setting up a personal meeting in an office, right?
Yeah, that's right. Whether that's in your community, in your district, get to know who the representatives are, the staffers are in those communities, and oftentimes they're going to refer you out to the Washington D.C. office. And every member of Congress has a health staffer, and you can always call them. Call the number on their website and ask to speak to their health staff or get their email. And just send them a note and say, hey, I want to talk to you about this really important bill. I'd like to get you some more information. What's the best way to do that? So yeah, that is really easy, and they're very accessible.
Yeah. Good points all. All right, we're going to get into a couple of questions that have been submitted. The first one is, how does John Filardo look so good and trim at his advanced age?
Yeah.
Oh,
That's
thanks, Mom. No, it's okay. If Medicare is supposed to be budget neutral at some point, how can added chiropractic services increase costs?
Yeah. So I think what we're talking about is really just making sure that chiropractors are able to provide the services already captured in the system. And really that's what we've been talking about. We've been talking about the Congressional Budget Office, who's going to be the one that actually scores this bill and gives it a potential cost or saving on it. They're going to say, well, there's going to be more utilization and those kind of things. And we say, good, that is what we want. We want more access. But what we've also provided to the Congressional Budget Office is studies that the ACA has done that showed not only are we going to give them better access and they're going to live healthier lives, but we're going to avoid costly surgeries. We're going to avoid opioid usage. That has been really helpful. We have work to do. We're going to continue to beat on them because at the end of the day, we think this really should be very low cost, budget neutral, or potentially even a savings since we're really not doing anything that's not already being captured by the system.
I wish I remembered the number, but there was an article in the national press not too long ago about the unneeded surgeries taking place in Medicare. And it was in the billions with a B. So yeah, that's a good point. We have another one as well, and this is it's related. In the recently released physician fee schedule was a proposal to move away from the AMA structure to determine fees for services and move that process in-house. Now I know it's early in the process with all this, but what do you think may be happening there, Brian?
Yeah, I mean, I think that's something that has been talked about for quite some time. It really comes down to who owns the codes, the CPT codes. How are they valued? Right now, obviously, we rely greatly on the AMA and the process they have to update that, and CMS adopts it. But there's a lot of the CMS pays a lot of money for that. Should they own it? Should be internal. I really think this is just the start of the discussion. I know ACA is going to comment on that, and the physician community will at large. It remains to be seen, but I don't think we've seen the end of it. This is the start of a conversation.
Yeah, no, that's exactly right. And I think it's very important, as y'all have thoughts about this, to share that with ACA and make sure that your voices are being heard as part of that, and they can convey that in.
Yeah. Well, before we wrap up, and I want to thank you folks for coming over and doing this. I just want to do one last thing. I want to plug our Engage 2026, January 22nd to the 24th in Washington. And registration has now opened for that. And so go on our website at acatoday.org and make sure you register for Engage. And also, if you have any other questions, you can put them in the comments and we'll get back to you in the comments for that as well. I'm being summoned that I have a couple more questions. Let me see. What do we have? Okay, what should we be focusing on if our member of Congress is already a co-sponsor? I can answer that one. Mm-hmm. Thank you.
Yes.
Thank you. They don't hear it enough.
Mm-hmm.
And that's an easy one. If you see your member of Congress as they're walking around in August, thank them for being a co-sponsor.
Well, and John, too, on that point, I think when we think about engaging with staff, that's a great time to send them an email. Hey, see him in August. Mm-hmm. Go tell the member person thank you, but then follow up with the staff and say, hey, I was able to do this. I just want to let you know that I said thank you. I know the staff worked behind it, so thank you too for that. And then, hey, when the time comes, can you call Jason Smith or Richard Neal and get this done? So again, we're spending a little goodwill on the front end, say thank you, and then ask for a little bit more a little bit later on. I did that just yesterday. I met with a Ways and Means member who was a co-sponsor, and I said to her, can you tap the chairman on the shoulder when you see him on the floor next time? Oh, sure. Exactly. Well, this is our last question. Congressional Republicans just spent weeks talking about how CBO is always wrong. How can you rely on that to score HR 539-106? Yeah, there's a lot of concerns about that. At the end of the day, I think in a bipartisan package, the numbers are going to matter. Whether that's the Democrats say, hey, we want to spend this much money on something else, we got to find some savings. So while there's been a lot of concern about the discount, and that's really more at a macroeconomic level about what's the impact of the tax cuts, are they going to generate growth or not? When it comes down to some of the nuts and bolts of Medicare policy, those numbers tend to match up a little bit more on utilization. Now, that's not to say we're not working really hard to say, okay, what we think we'll get an initial score on our bill. Are they right? Are they wrong? We've got a lot of data behind it. We've been pushing them for years. So hopefully when that number comes out, it's, again, a very small, potentially small score. But if we get to a savings, that's great. Use it.
Yeah,
right.
That's what we're really hoping.
Now, I always found, and I think you guys think the same way, there's like a love-hate relationship with CBO. If they come back with a score that's agreeable, they love CBO. CBO did a great job. If it's not so great, no, CBO is really has missed the boat on this one again.
There is a long bipartisan tradition.
Yes, and that's bipartisan.
Yeah.
Guys, thank you again so much for coming over. Thanks for doing this. I think this was great. Hopefully you folks out there found it helpful, and let's do it again sometime soon.
Wonderful.
We'd
Thank
love
you very
to.
much.
Thank you all.
Thank you.